improving farm level biosecurity, because in doing so they will use less antibiotics because animals will not fall ill often.
I think we need to manage the environment well. We need to manage the environment where the fish or the poultry is raised. We need to manage what is coming in, what is going out. For example, better farm management practices in poultry, better biosecurity would help a lot. Similarly, the wastewater from aquaculture ponds which is coming out, managing that quality would also help. It is extremely important to work on this dimension because environment is largely neglected as of now, and we need to put a lot more focus on that.
One practice that really needs more emphasis is sanitation. And sanitation in most places in smallholder production systems is usually the responsibility of women. So that means when we talk about antimicrobial resistance prevention, we have to make more of an intentional outreach to the women who are responsible for the cleanliness so that we reduce the disease burden in the first place and therefore have less need for antimicrobials.
I think in African context we have to talk in three points. The first one is the regulation, which is to have a good regulation body for quality control and registration of veterinary vaccine or also for veterinary drugs. And also we need to have a good distribution and also have a good veterinary practice. And then at the end to have a good awareness of a farmer on the use of veterinary drug and also the impact which can have on human life.
I think AMR in animal agriculture is a complex problem, and it sometimes is referred to as a wicked problem. I think the boundaries, we don't know very well the boundaries, we don't understand, and our focus has been really looking at almost exclusively at use, and we're avoiding the kind of environmental parameters, which I think are very important. So I think we need to rethink of how we think about this, and I think interdisciplinarity has been very useful in solving complex problems, and I think that's really what we should be focusing on.
My keywords would be veterinary supervision, meaning that when a farmer does need an antimicrobial, he does have access to, for the sake of the health and welfare of his animals, to a good quality product, properly registered, and then the drug is administered under veterinary supervision, properly trained, and with supervision of the veterinary services, both from the public and the private sectors.
So infectious disease is a major constraint to livestock production. In our view, any animal that gets sick is going to get an antibiotic, rightly or wrongly. If we can give them multivalent vaccines which diminish the level and impact of infectious diseases, immediately that's one less animal that's treated with antibiotics and one chance to reduce the use of antibiotics.
Well, prevention is better than cure. So I would say the development and use of effective vaccines would be one way of doing that.